Hi, I'm Ann Henning, and I've been a registered nurse for over 15 years, and 12 of those years were on an oncology unit at the bedside, as well as being a supervisor for that unit. Today, we're going to talk about a culture of patient safety and how we create that with addressing compliance with medical line entanglement, also called MLE, and tubing misconnections. So we know that the number one goal is patient safety and patient outcome. That's true for the patient, the staff, and the hospital. We all want that, as well as this whole list of regulatory compliance boards that might also be addressing these goals. So we're also going to talk about how we can address each of these specific issues, such as tubing misconnections. Well, what is this? There's been multiple medical devices that connect to patients, and oftentimes they have similar or identical connectors. Companies are doing things to create different mechanisms so that two things that should not be connected together don't connect together. But in the meantime, nurses are kings and queens of workarounds. So anything can happen. A tubing misconnection can happen by a staff, untrained staff, a staff practicing outside their scope of practice, by a patient who thought they knew what they were doing, by a family member. So a lot can happen. So we need safety measures in place, comprehensive policies, procedures, and methods of preventing this from happening. Okay. So once again, on misconnection prevention, both the World Health Organization and the Joint Commission have mentioned that it could be a deadly occurrence. You could imagine two things getting connected together and how that would impact the patient, and it has happened. So one step of action you can do is post informative signage. So the one with the orange border, that's for the patient and staff to know that they do not touch any lines, tubings, drains that they are unsure of or instructed not to touch. They call a staff member to come help them. And then with the blue border, this focuses on the nursing interventions, such as having the proper handoff communication at the bedside. And before connecting anything new to the patient, they would want to trace from the patient to the source where you're going to connect something, just as safety practice. Okay, one can also use something like a line organizer. That's what I'm all about. My mother, who was a nurse of 40 years, invented this very product. Okay, I'm going to tell you what it can do for you. It can help decrease time spent untangling lines. This is also called the spaghetti syndrome. I laugh because if you're a nurse, you know what I'm talking about. It will help decrease the chances of contamination, just meaning it's keeping things off the floor. It's keeping the call light off the floor, which is a high touch object, keeps the oxygen off the floor, keeps IV off the floor. You know, we do unhook IVs and we cap it, but still, we don't want anything touching the floor. It increases patient safety and satisfaction. It increases operational efficiency. So not just the nurse at the bedside, but also will help the respiratory therapist, occupational therapist, physical therapists. And who is the biggest expense of the budget at the hospital? The nursing labor. So let's have them use their time wisely. Okay. It involves the patient in their care. This is why the patients are more satisfied. ICUs love this product because it organizes everything, and ICU loves to have everything organized. However, on med-surg floors, you often have patients that are alert and orientated. So you want to have them involved in their care. They like to see where everything is, and it keeps the call light in reach. I cannot stress this enough. I've come into patients' rooms, and they were so grateful to see me because they had pressed the button on the bed for the nurse. However, it didn't work. So 20 minutes they waited, and they needed the nurse urgently, but the call light was on the floor. So even if your patient has a call light, they should have a line organizer to keep it in place at the bedside. Okay, decreases time and rework. Imagine a peripheral IV getting dislodged because it got tangled or impinged, or a certain medication got tangled, impinged. This can all happen. So taking steps to prevent waste and rework is important. Also decreases the risk of tripping by both patients, family members at the bedside, and staff. Okay, most people find us after a fall has occurred. I know that I one time tripped on a line at the bedside and my heart stopped for a moment because I knew the patient was starting dialysis and was hooked up. Luckily, it was just a phone cord, but anything can happen. Line reconciliation process. The Beata Clasp serves as a great visual prompt to do this line tracing. Remember, from the patient to the source. Trace it each time at handoff. And it also encourages patients and families to ask the questions to the nurse about their tubings, lines, and drains. Okay, here's an exciting page. I'm going to talk about how to use the Beata Clasp line organizer. As you know, it holds medical tubing. It's simple in design. There's no in-service needed, except if you want to show this less than 1 minute video. It's latex-free and adhesive-free. Here we go.
Let me introduce you to this new product created and designed by a nurse. It is called the Beata Clasp, and this product right here will make your life so much easier, especially if you work in direct care at the bedside. This device fits snugly on the bed rail, and what it will do, it will help you organize all of your lines and tubing so that way you're not a tangled mess. Here I have some supplies, a pulse ox, IV tubing, and of course the call bell. Let's not forget suction setup. Look how each of these tubings fit snugly and conveniently into the Beata Clasp. First I have suction, IV tubing, pulse ox, and of course we cannot forget the call bell. The Beata Clasp is environmentally friendly. It is easy to clean, meaning that it's reusable. And I think all hospitals should invest in this to make their nurses' lives easier.
So you can see that's a wonderful testimonial. What I like is that she did everything one-handed. Just imagine if you had two hands and you can do so much more with the Beata Clasp. Don't forget, if you have more than 4 lines, you can also just add another Beata Clasp to the bed rail. Okay, why do we want it adhesive-free? So here you can see where the problem originally started. Nurses, queens and kings of workarounds, would tape a medicine cup or a tongue depressor to the bed rail to keep all those tubings, lines, and drains from sliding down the bed rail from gravity, okay, causing them to get impinged, lost, dislodged, okay? But what happens when you tape something to the bed rail, it often leaves a tape residue. And this can be often hard to remove, maybe goes unnoticed, and can attract bacteria. So that is why our Beata Clasp line organizer is adhesive-free. Let's talk about medical line entanglement, MLE. This is a serious patient safety concern and needs programs in place, a comprehensive approach, just like tubing misconnections, to be proactive and prevent any consequences to the patient, which could be harmful. So we're going to talk about proactive ways, probably using a line organizer, that we can manage this. All right, the US Food and Drug Administration published a recent communication last year talking about the risk of strangulation from internal feeding delivery sets. And that's just one example of how medical line entanglement can be dangerous to the patients. Caregivers reported that their child had experienced entanglement of their lines, but only 9% recalled getting discharge education about it, about how to manage these cords. So once again, a comprehensive approach is needed. However, if you're already using the medical line organizer, at the hospital for that patient, and then they have to go home with a device that requires tubings, lines, or drains, then you're all set. You give them education about their care at home. We always give education about how to manage their tubings, lines, and drains. But do we tell them how to manage just the frustration of all of those lines being tangled and making them feel like a puppet? So this provides sending them home with the line organizer provides an additional layer of patient safety. It really does help show that you're being proactive as a hospital and you're demonstrating taking steps to create patient safety. And this is such an inexpensive solution, and it's practical, easy to implement. And I really feel it's not only beneficial to the patients, but it's also beneficial to the staff. And just think about if you can prevent one fall, it's worth it. Because falls are never going away, and we all know that all falls should be prevented in the hospital. Definitely prompts intuitive compliance. It directs users to take the correct action. Like I said, it's a visual prompt to do line tracing. Hey, what's the policy procedure guidelines on our tubings, lines, and drains here at the hospital? Doesn't need any training. And you easily involve the patient and their family in their care, which gives you better outcomes. All right, once again, I just want to show how effortless it is to use, that you can transfer it from IV poles to wheelchairs, walkers. So this is great for all frontline workers who are interacting with the patient, from the nurses, respiratory therapists, physical therapists, occupational therapists. In conclusion, it really does help the nurse take one more step, one more thought action, a pause, a timeout, if you say, before making a tubing misconnection error. It prevents the waste and rework at the bedside. It eliminates the problem, sometimes simple, but all too often, of a lost call life. And it eliminates that spaghetti syndrome, decreases contamination, and once again, involves patients and families in their care. That's so important. Usually the patient wants to be involved, and you have another person on your team when the patient is actively involved. It would prevent, readmissions. There's so many benefits to having a patient involved in their care. So once again, I talked to you about bringing safety back to the bedside and using a line organizer device. If you have any questions, feel free to reach out. We have our website, email, 1-800 number, and I thank you for your time. And if you have any questions about compliance with MLE or tubing misconnections, please reach out, but be proactive, be ahead of the game. Because what would you do if the Joint Commission rounded today and asked, what do you do for tubing, line, and drain management? I think your first answer, well, take a deep breath and then say, well, we're proactive in preventing any risk to the patient. Thank you so much.